Conjunctivitis, commonly known as pink eye or red eye, is an inflammation or infection of the conjunctiva, the thin, transparent tissue that lines the inner surface of the eyelid and covers the white part of the eye. This condition can affect one or both eyes and is characterized by redness, irritation, and discomfort. Types and causes: viral conjunctivitis. This is the most common form of conjunctivitis and is usually caused by adenoviruses. It is highly contagious and often accompanies symptoms of a common cold, such as a sore throat, cough, and runny nose. Bacterial conjunctivitis, caused by bacteria such as Staphylococcus aureus, Streptococcus pneumonia, or Haemophilus influenzae. Bacterial conjunctivitis leads to a more pronounced purulent pus-like discharge. It is also contagious and can spread quickly, particularly in crowded environments like schools or daycare centers. Allergic conjunctivitis, triggered by allergens like pollen, pet dander, or dust mites. Allergic conjunctivitis is not contagious. It is often associated with other allergy symptoms, such as sneezing, itching, and watery eyes. Irritant conjunctivitis. This type occurs when the eye is exposed to irritants such as smoke, chlorine in swimming pools, or chemical fumes. The reaction is usually temporary and resolves once the irritant is removed. Symptoms: common symptoms of conjunctivitis include redness in the white of the eye or inner eyelid, increased tearing or watery eyes, itchiness or burning sensation, a gritty feeling in the eye as if something is in it, discharge from the eye that may be clear, yellow, white, or green, crusting of the eyelids especially after sleep. In viral and bacterial cases, symptoms may include swelling of the conjunctiva and eyelids, while allergic conjunctivitis typically presents with intense itching. Diagnosis is usually based on the patient's history and clinical examination. A healthcare professional may ask about recent exposures, such as contact with someone who has a similar condition or recent upper respiratory infections. In some cases, swabs or cultures may be taken to identify the specific infectious agent, especially if the condition does not improve with standard treatment. Treatment depends on the underlying cause. Viral conjunctivitis. Typically, this form is self-limiting and may resolve within 1 to 2 weeks. Supportive care such as cool compresses, lubricating eye drops, and good hygiene practices are recommended. In severe cases, antiviral medication may be considered. Bacterial conjunctivitis, often treated with antibiotic eye drops or ointments to help speed up recovery and reduce the risk of transmission. Improvement is usually seen within a few days of starting treatment. Allergic conjunctivitis, managed with antihistamine or anti-inflammatory eye drops, and by avoiding the allergens when possible. Oral antihistamines may also be recommended. Irritant conjunctivitis generally improves once the irritant is removed. Rinsing the eyes with saline or water can help alleviate symptoms. Preventive measures include hygiene. Frequent hand washing and avoiding touching the eyes can reduce the spread of infectious conjunctivitis. Avoid sharing personal items. Do not share towels, makeup, or eye care products. Proper disinfection. Clean and disinfect surfaces that are frequently touched, especially in communal settings. Allergen avoidance. For allergic conjunctivitis, managing exposure to known allergens is key. Use of protective eyewear. In environments with chemical irritants or dust, wearing protective eyewear can help prevent irritant conjunctivitis. Complications. While most cases of conjunctivitis are mild and resolve without serious complications, some potential issues can arise. Chronic conjunctivitis. In some cases, particularly with allergic or untreated bacterial infections, inflammation may persist or recur. Vision problems. Although rare, severe or untreated cases can lead to complications that affect vision. Spread of infection. Both viral and bacterial conjunctivitis are highly contagious and can lead to outbreaks if proper hygiene practices are not followed. Conclusion: conjunctivitis is a common eye condition with several causes, including viruses, bacteria, allergens, and irritants. Recognizing the symptoms and understanding the underlying cause are crucial for effective treatment and prevention. While most cases are mild and resolve with proper care, maintaining good hygiene and taking preventive measures can help minimize the risk of transmission and complications. Regular consultation with healthcare providers ensures that any severe or persistent symptoms are appropriately managed.